Chairwoman, thank you. Thank you very much for your presence today. Let me start with Administrator Johnson. In your testimony, you mentioned that Hersa is working on better connecting substance abuse disorder treatment with access to mental health care. I come from a state, but I also come from a nation in which access to mental health care is limited for a number of reasons, but particularly the rural parts of our state, the inability to attract and retain health care professionals is a huge issue. I see this in my Veterans Affairs Committee, where we're trying to take steps necessary to prevent veteran suicide. The services, if they exist, are distance away. Senator Smith and I recently introduced a bill authorizing a grant program under Hersa to help primary care practices integrate behavioral health care services into their offices, designed to take those circumstances in which you do have a hometown physician, a family practice doctor, and bring mental health care services to that practice. Do you think better integrating behavioral health services into primary care settings for adults and children makes sense? And would that help address the substance abuse crisis that our country is facing?
Thank you, Senator. Thank you so much for your leadership on this issue. I think integrating behavioral health, mental health, and substance use disorder services in primary care is essential for us to confront this crisis. We are not going to be able to solve this problem unless people can get the care and services they need, and that means we have to deploy all available assets to the problem, and that means there needs to be no wrong door for getting in to get mental health and substance use disorder services. And that's why we're really focused on trying to leverage the programs at Hersa and are grateful for the support of this committee to identify ways that we can continue to help the primary care workforce understand and treat and identify mental health and substance use disorders.
Thank you. I intend to use your endorsement in our efforts to get the legislation passed. Dr. Delphin Rittman, in addition to serving on this committee, I'm also the lead Republican on the Appropriations Subcommittee that funds the Department of Justice. In your testimony, you touched on the First Responders Comprehensive Addiction and Recovery Act grant program, which helps to train and equip first responders to respond to overdose-related incidents. This grant program, as you noted, includes a rural set-aside. For many rural departments, the loss of man or woman power while an officer or deputy is off training is almost as prohibitive as the lack of funding. What is your department doing to make training and other resources more accessible, such as through online training courses to small and understaffed departments?
Thank you for that question, Senator. You're right. I mean, it's so important to be able to have multiple modalities to be able to offer training. And so we do have a number of training and technical assistance centers. So we have an addiction training and technical assistance center, as well as the provider clinical support system that provides a range of technical assistance, training, and education for prescribers, as well as other behavioral health providers in the field. And those include both in-person as well as remotely through webinars and online strategies and means as well.
I might suggest to you that, at least in our state, we have a number of law enforcement training centers across the state geographically. Mm-hmm. You may want to integrate your program or share the opportunity for training in those settings and utilize the services that generally law enforcement community has already created for ongoing training for members of law enforcement. I also appreciate your attention to ensuring that rural communities have the resources needed to fight fentanyl and substance abuse. There are two issues. These two issues are often associated with urban areas. I can assure, as you know, it is not a urban-suburban issue. It's not solely that. Rural America is battling the epidemic, and we are doing so with, as I indicated earlier, a more strained healthcare delivery system and limited workforce. One particular program you talk about in your testimony that Kansas is utilizing well is the Certified Community Behavioral Health Clinic programs. In 2021, Kansas became the first state to establish the model at the state level, and by 2024, we have 26 state-certified CCBHCs. Would you speak further to the role of localized care like these community mental health centers have in fighting substance abuse that we're talking about today.
Yes, absolutely. And I want to commend Kansas for having that number of CCBHCs. It is a wonderful model. It provides both mental health, substance use services, as well as coordination and connection and linkage to primary care services as well. It's a model that also provides wraparound prevention, treatment, and recovery services and supports. And so it's critical in terms of being able to connect people that are struggling with opioid use disorders, as well as other substance use disorders, to services and supports, to include recovery services and supports as well.
Thank you both for responding to my questions.
Senator Lujan.